In every operation, there's one key person who gives the anesthesia drug, basically known dawa ya kulala. Back to AIC Kijabe Hospital, where we are privileged to be with Professor Mark Newton. How are you?
Here. Good, great.
It's good to have you in our show.
Yeah, it's good to be here.
This is Golden Minute Show.
Okay.
Now we want to talk about anesthesia.
Okay.
And before we start, who is an anesthetist?
Yeah, so anesthesia is a big word, but it basically describes the type of either doctor or nurse that provides the medicine so that someone can have surgery while being asleep or not feeling any pain, or even sometimes you can numb up certain parts of the body, and that's considered anesthesia. So you don't need to go totally asleep for anesthesia. But anesthesia is just a general term that covers kind of a wide range of ideas. But basically, it's the part of medicine that helps with pain and surgery and being put to sleep and sedation and things. You
talked about numbing an organ.
Right.
So even if it was a finger,
right,
it's still anesthesia.
Right.
Okay.
Yeah.
Now, before a patient goes to theater, there's the pre-medication part.
Yeah.
So what does it involve?
Well, I mean, pre-medication means before you go to surgery, you may need to have some kind of medication that either makes you more relaxed or takes away some of your pain, or you may have a pre-medication that helps decrease the acidity in your stomach. And so those are what most people describe as pre-medications before they come to surgery.
And in this pre-medication, is it only the anesthesia drugs that are given, or there are other drugs that maybe prophylactically are there drugs that are given?
Yeah, it depends on what you want for a pre-medication. If you want a medicine that helps with an upset stomach, you don't need to take an anesthesia drug. And sometimes people are giving pre-medications that are the same drugs that they would give on the wards. So if someone needs some medicines to make them sleepy for a short period of time, and they may be given a pre-medication, like some sort of it's called a benzodiazepine. But pre-medications, it just depends on the problem and what you want to do with the pre-medication before they come to the theater.
Is there anything else that is involved in pre-medication, like the rights of a patient?
Well, I mean, usually when an anesthesia provider, whether it be a doctor or a clinical officer or a nurse, would do a preoperative visit. So they would visit the patient, and one of the things that they would do is do a history and physical. They would do a complete history and physical on the patient. They would ask them if they have any allergies to medications. They would listen to their heart, their lungs, and basically find out if there's any coexisting problems, any coexisting diseases. So for example, if someone had high blood pressure, they would talk about the high blood pressure, and they would see if they're on any medications for high blood pressure, and then decide on if they should get that medicine before surgery.
Okay.
And so during that time, they're explaining to them about the anesthesia part and getting their consent for anesthesia, and they would give them an anesthesia plan. And part of that anesthesia plan would be possibly a preoperative medication. And so they would ask them about that. They would say, "Are you anxious?" They may say, I'm super anxious. I need some sedation." And then the doctor would, or nurse or clinical officer would have to decide if it's appropriate. Sometimes it is appropriate, sometimes it's not appropriate. Many times pre-medications are not even required. It just depends on the situation.
Thank you. Now, personally, I'm very interested about this pregnant mother.
Right.
When you go as an anesthetist to review this mother who is maybe scheduled for an emergency or an elective cesarean section, is there any lab work that you need?
Right. I mean, and again, there's this preoperative visit, and they would discuss their problems and see if there's anything that is a coexisting disease, and then they would decide on if labs need to be done. But basically, healthy mothers who come in, they need to do a blood test and see how much hemoglobin they have in their body. So they do a complete blood count, and they check their hemoglobin, their hematocrit. They also check their platelet count. Platelets are very, very important, which stop bleeding if you have a...
Maybe you can tell us about the platelets.
Yeah, so platelets are part of your blood system that when you cut yourself, it kind of forms a clot. and it stops the bleeding.
So it's the cells in the blood that helps form a clot.
Right. And so you make them all the time in your body, and when you make those, there's a certain number it should be. So the normal range is about 150,000 to 400,000. And so you would want a mother who's healthy, who's coming to surgery, to have a normal platelet count. But if she doesn't, you would have to change your plan. You would have to let the surgeon know, and also the anesthesia know, because it may adjust what type of anesthesia you give. So you would want to know what's in the blood as far as the blood system, but also you may want to know what the electrolytes are, the sodium, potassium, creatinine.
That's about the kidneys now.
That's about
the state of the kidneys.
Yeah, but most women who are healthy, those will be fairly normal. But if they come in and there's other problems, and for example, this disease called preeclampsia, then they would want to know what the creatinine would be, what the sodium would be, what the potassium would be. So they want to make sure their kidneys are okay.
Because kidneys are very necessary in the fluid elimination and
Right.
also the maintenance of the body as a whole. Kidneys are key.
Yeah, I mean, your kidneys are what allow you to get rid of the bad parts in your system. It kind of is a filter, and it filters off, keeps the good things and filters off the fluid. So if your kidneys do not work, then you would get really swollen and puffy, and that would be a problem anytime. But especially when you're pregnant, and there's some diseases of pregnancy that affect your kidneys.
Now let us talk about this mother who is scheduled for a cesarean section,
Right.
and she has a condition like diabetes.
Okay.
Will this with the diabetes dictate this kind of anesthesia the patient is going to get?
Yeah, I mean, if a mother came and she had diabetes, so it was gestational diabetes, so
Yeah.
she can be just diabetic from being pregnant, you would have to determine how you want to manage that.
So are you going to first control the sugars, or she can get to theater at any levels of sugars?
Right, we would want to control the sugars, and so certainly if she was being seen by an obstetrician in the prenatal area, hopefully they would be trying to control the sugars. Now some mothers who have diabetes, it can be controlled with diet, and others need insulin.
Yeah.
So it just depends on how bad the diabetes is. But certainly it has to be controlled. So before they come to surgery, you would have to check their sugar levels, maybe every hour, every 2 hours, to make sure when they're coming to theater, if they have to come to theater, that you're able to get a fairly normal value for the sugar.
Now our mother is already in theater.
Okay.
And you're there giving the anesthesia.
Okay.
Are there types of anesthesia, or it's just one? Like when the patient comes in, you just know what to do.
Right.
Or are there types?
Well, I mean, for all of us, I mean, if someone's healthy and not pregnant and a female, her body would respond to anesthesia differently than someone who is pregnant. And so when you're pregnant, all pregnant mothers will tell you that something's going on with my body, I'm gaining weight, my back hurts, and maybe my voice is different, and you know, there's a lot of things that are happening when you're pregnant, and so those are all changes in your physiology. And so it affects your heart, it affects your breathing, it affects your stomach, it affects your muscles, it affects your back and how you move, and there's many things that are affected from pregnancy. So based upon that, the anesthesia is going to be different.
Okay.
So if you're a 25-year-old female who's coming in for knee surgery and you're not pregnant, that could be a different anesthetic than someone who's pregnant and needs to have an anesthetic.
Thank you very much, Professor. I think we need to go for a break. When we come back, we'll know about the spinal, where the patient goes numb from the stomach down, and while the patient sleeps.
Oh, good. That'll be great.
Okay.
Excellent.
Don't leave us. We'll be back.
Good.
Thank you for keeping with us as we continue discussing anesthesia. Daktari,
Yes.
can you tell us what is this local anesthesia, or spinal blocks, or the general anesthesia?
Yeah, so when someone comes in that needs to have a cesarean section, there's a reason why they're coming in. Either they've had a previous cesarean section and the obstetrician knows that they need to have another cesarean section for the next ones, or it's their first child and something's gone wrong.
An emergency
An
came
emergency.
up.
So they have to bring them more quickly to the theater. And so as anesthesia providers, you have to decide on what type of anesthesia. So there's really two types. One type is called spinal anesthesia, okay? And basically the easiest way to describe that is that when you go to the dentist and they numb up your gums or your tooth gets numb. That's local anesthesia.
Local is
Local,
it
like,
just makes that
just in
area.
that little area, they're giving you dawa to numb up your tooth. Well, so that's a type of anesthetic drug that's called lidocaine or bupivacaine or ropivacaine. They're big words. But basically, we can give that type of medicine in around your spinal cord with a needle.
You put a needle through to the spinal cord.
We actually put a needle, and so that's
Must
why
be very painful.
Well, you can numb it up so it's not as painful. But during contractions, if you're having contractions, it's no more painful than that.
The contractions,
The
are
contractions
always
are worse.
the most painful.
Right, very, very painful.
Very painful.
Yeah, and so it's done in a way where you're explaining what you're doing to the mother and describing to her what you're going to do, and you basically have to set up. You have to have monitors on, so you're monitoring the heart rate, the blood pressure, the saturation, and then you're cleaning off the back, and you're putting sterile drapes on. So it's done with sterile gloves, with your mask on. Everything's sterile to
And
prevent
you're also
infection.
qualified, you're skilled, you're knowledgeable, you're qualified.
Right. You have to be trained to do
You're
it.
the person.
Right. You
Yeah.
don't want to just have someone randomly doing this.
Sure.
And so it's basically having them set up and then putting this needle in a space where fluid around the spinal cord comes out, and then you give this local anesthesia.
That's now the CSF.
The CSF. So the CSF comes out, and you inject
Cerebrospinal fluid.
cerebral spinal fluid, and then you give local anesthesia. That's also special local anesthetic for spinal anesthesia. So there's a lot of type of local anesthesia. So the local that you would put on your hand is not the same local
you put in the-
you put in the spinal cord. So
Okay.
there's certain type of anesthetic. So you need to know the dose, you need to know the volume, you need to have the special needle to do that, you need to have the skills to do it, and then you need to be able to understand all the complications.
And now, as we talk about the dose,
Yeah,
it depends with the mother.
right.
So, like, the dose I'll receive is not what another woman will receive.
Right. It depends on how tall you are and maybe your weight. But basically for the spinal cord, it's basically the same.
Okay.
It may adjust a little bit, but not really.
Okay.
And so people basically know the dose is the same for every mother.
Okay.
And they want it to go to a certain height. And so one of the things that they would explain is we're giving you the dawa. Your legs are going to start getting numb and start feeling heavy, start feeling warm.
To a point you won't lift them up.
Right, you can't lift them up. And so the medicine comes up to about right here. And so below this level, which is T4, you will start to feel heaviness. Your legs will feel numb. And that's when they can start operating. But everything has to be numb before that happens. One of the things that mothers get confused about is that they can't lift their legs, but they can feel someone touching them, rubbing them.
Yes.
That's different.
Okay.
If you cannot lift your legs and you can't feel someone pinching you, it should be numb for surgery.
It's true.
Right. And sometimes at that time you have to have an intravenous line in, so you have to be getting fluids. You also have to be getting oxygen through a little nasal cannula to give yourself oxygen, but also give the baby oxygen. It makes the baby have oxygen before they're delivered.
Okay.
And those are some of the sometimes the mothers feel a little anxious, a little bit nauseated, but the doctor or the nurse or the clinical officer who's been trained is there to take care of you. And you're still talking. So during the whole time,
You're talking.
You're talking, so you can have a communication with the anesthesia provider, and they can be telling you that the surgery is about to start, and when you can hear the baby cry.
You will even see it.
You will even see the baby.
Sure.
And here at Kajabi Hospital, they actually bring the baby around for the mom to greet the baby and kiss the baby and hold.
Which is very good.
It's very good. It's very good. So that's spinal anesthesia. That's by far the safest way to have anesthesia. The second way is general anesthesia. Now, general anesthesia in Africa is done. It's done all over the world. But if you have a choice, if there's options, it's best to have a spinal anesthetic.
Now, when you talk about choice, does a patient have a right to choose?
Yeah, most doctors will tell them the choices, and they will try to convince them to have a spinal anesthetic. But if the mom is really adamant that she has to have a general, the doctor and the nurse or clinical officer may discuss that with her again. But my practice would be to still try to convince them
To have a spinal.
to have a spinal. But if you're not skilled on doing the spinal, you should do a general, the provider. And so certainly there are some situations where the mother may be bleeding, or there may be other problems where you have to have a general anesthesia. So it's not always true to do a spinal. So a general anesthetic, what does that mean? That means your whole body is going to go to sleep. You're not going to be talking.
You're not going to be hearing.
You won't hear the baby born. You won't hear. You won't talk. You won't feel. Your whole body's asleep.
You can say you're dead.
Yeah, you're very sleepy.
You're dead in quotes.
But part of the job is to make sure you're asleep enough so you don't basically feel anything, and that means that you will have a breathing tube put in. You may have a sore throat, and those things.
So in general anesthesia, even breathing is an issue. You won't breathe.
Yeah, the doctor needs to control your breathing for some of that time.
With these other very many machines over here.
Right, these types of machines are built to help control the breathing, but based upon the pregnancy, you have to protect the airway. So you have to have a breathing tube in the airway. So that's why you have to have someone fully trained to do it. You can't learn this in 5 days. It takes a long time to learn it. So you have to be a clinical officer, a doctor who's an anesthesiologist, or a Kenyan registered nurse anesthetist to be trained to do this.
Not just anybody.
Not just
somebody
anybody.
who has gone a diploma certificate.
Right, it's a diploma, or certainly doctors or specialists,
Yeah.
and they're trained to do that. But it can't be just anyone.
Which you're doing here in Kijabe?
That's what we're doing here in Kijabe Hospital.
Okay, that's very nice. Now, is there any time when a spinal anesthesia can complicate?
Well, certainly anytime you give anybody a medication, there can be reactions to the medication, whether it's a spinal or a general. But in general, if you do a spinal anesthetic, your body, your blood pressure may go down, and the person who's doing the anesthesia is trained to make the blood pressure go up. And it's basically, I've been doing anesthesia for 25 years, and I've never seen a mother have any bleeding or an infection from a spinal. I've never seen that. And so that's very, 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 very rare. So it's basically safe. But you have to have someone who's trained to do it. You shouldn't have someone who's not trained in an anesthesia program doing this. Yeah.
I've heard of some conditions, for example, asthma, which can affect the general anesthesia.
Right.
How true is that?
Yeah, if someone does have asthma, I would certainly do a spinal anesthetic. Because general anesthesia, anytime you put anything in your lungs, the asthma can come up.
And asthma is lungs related.
And asthma is in the lungs. Yeah, so you would try to avoid a general anesthetic if you can for someone who has asthma.
That's very nice.
Yeah.
We need to go for a break.
Okay.
This is great.
Okay.
When we come back, we'll talk about any other complication.
Okay, great.
Don't go.
Great.
We will be back.
Thank you.
Thank you very much for being with us this far. For any comment, for any question, kindly use the number on your screen. Daktari,
Yes.
kindly tell me any complication that can arise after the GA.
Okay.
Maybe a patient should know right before they get into theater.
Right. So there can be complications, and so general anesthetic, since you do go to sleep, it's different than if you're not pregnant. So if you're pregnant, your breathing tube, your airway up here, everything's swollen. So your body's kind of swollen, your airway's swollen, and things like that. So the risk of having a general anesthetic is a little bit higher, mainly because of your breathing. That can be affected. But it's not something that you can have it safely for sure, but it is a little bit more risky than a spinal. Certainly a general anesthetic can make you more nauseated. than a spinal. Giving a spinal and giving narcotics like morphine into the spinal space with local anesthetic, your whole body will be pain-free for a longer period of time. So that's one part. Certainly, anything you give the mother, as far as a general anesthetic, can go to the baby.
Yes.
So medicines that
before
are given
it is extracted.
before the baby comes out. So you need to be in a place where they can watch the baby closely during a general anesthetic.
Now, what you want to say is general anesthesia can also affect the baby.
It can.
So once it is given, the operating team needs to be very fast
Right.
to get the baby out.
Right.
Unlike the spinal anesthesia.
Right. So if you're doing a general anesthetic, the obstetrician, the person's doing the C-section,
The
needs to be-
midwife.
the midwife or anybody needs to be ready to go, so that the baby can come out. There's a whole team there to take the baby, make sure the baby's doing okay, and if they need to have resuscitation, take care of the baby. But it's one of those things that any time you give a mother any medication before the baby comes out, the
baby
baby's going
gets
to
it.
have it. So you have to do it quickly. Yeah, which can be done. All over the world, 25% of all mothers potentially would have a cesarean section, and then it just depends on how you have it done, general or regional, and it depends on where you are in the world,
Okay.
how you would do that.
The setup of the hospital.
Well, yeah, and if it would be done under a spinal or a general anesthetic. But overall, globally, the statistics show by far the safest is to have a spinal. Sometimes people have an epidural. Epidural is kind of new. That's a different topic. But having an epidural in place before you go into labor also can be used. But it's basically similar to a spinal. But yeah,
Okay.
it's a different
Okay.
type of anesthetic.
This is very big.
Okay.
So in case of an emergency, for example,
Right.
Ruptured uterus,
Right.
what would be the best anesthesia to give?
Yeah. Anytime there's bleeding, and it's hard to tell how much bleeding there is, they have to have a general anesthetic.
So now here, generally, as much as it is
Right.
the worst, or
Right.
rather the bad one,
Yeah.
it now becomes the important one.
For sure.
Okay.
And so many mothers, that's one of the main reasons why mothers all over the world have problems, is there's bleeding.
Okay.
So there's a lot of reasons why you could have bleeding, and you would know as a midwife and about those things. But if they're bleeding and there's a ruptured uterus, it's a general anesthetic. Yeah.
Now, maybe my last question: is
Yeah.
there any drug that affects the contraction of the uterus? Maybe is it called atony? Is
Yeah.
there any that can cause
Right.
the atony of the uterus?
Yeah. So if the uterus after the baby comes out is not contracting, not basically stopping the bleeding, the number one reason could be the anesthetics, the general anesthetics. So there's 2 or 3 general anesthetics, but that can affect the uterus. And so sometimes the obstetricians will say, when the mom's under general anesthesia, how much anesthetic, general inhalation anesthetic you have, and you may need to turn it down. So
Okay.
it can affect it.
Okay.
Yeah. You'd have to have a big dose to affect that, but it could.
It could affect.
Right.
And also because people are different.
Right.
Whatever affects me might not even
Right.
be any.
And so you may have to change the anesthetic. If the uterus is not contracting, you may need to decrease the anesthetic you're breathing in and change it.
and increase the drug
The
that
IV.
now causes, or rather facilitates
Right.
the uterine contraction. That is very nice.
Yeah.
So in Kijabe you train anesthetists?
Right, and so in Kajabi, and we train nurses to do anesthesia. The country of Kenya, and really all over the world, there's anesthesia providers, and there's doctors who are specialists who go to medical school, and then they train for 3 or 4 years as a specialist, and then sometimes they subspecialize. And so I feel that the best model is a team model, where you have doctors who are leading the team, and who's an anesthesiologist, and then you have people who are not physicians, and that can be, in Kenya there's clinical officers, and there's registered nurses, and so there's programs in the country that train either one of those, and those would be called the non-physician anesthesia providers. And many times in Kenya and other countries in Africa, there's just not enough doctors. And so there can't be a doctor at every district hospital where a mother comes in
Yes.
for a cesarean section. So you have to train non-physicians at a high level to do that.
It is true.
And so through the Kenyan Society of Anesthesiologists, they're trying to help guide the country and help guide the government to say anesthesia is important.
It's key.
Right.
Yes.
Yeah. And you can't really have a safe cesarean section without having safe anesthesia providers. And so a team model...
And the operating doctor can do that too.
The operating
cannot
doctor
act as
cannot
the
do that.
anesthetist and also the surgeon.
And so that's very old school,
Yes.
many years ago, where you would have somebody doing the surgery and doing the anesthesia. That's very dangerous. And so I think our goal should be to aim high, and every mother is valuable, and every mother that comes in, it's a frightening situation to have a C-section. She needs to be able to trust her anesthesia providers. And so we need to have the doctors lead us all and train as many non-physicians, clinical officers, and registered nurses as possible. So that everybody in the whole country, whether you're urban or rural or very rural, if they have to have a cesarean section or resuscitation or resuscitate the baby, there's someone there that's trained to do that. And they can help the midwife. So if the midwife is there resuscitating the baby, they can't do everything.
They cannot do it.
Yeah, they need to work as a
She
team.
cannot receive the baby, resuscitate the baby, yet controlling the machines and doing all the other
No,
things.
and try to help the mother. So I truly believe that it needs to be a team model. I believe that there are some excellent doctors and who are leading and nurses and clinical officers. We can all work together. And certainly Kajabi Hospital is involved in that. For the last 10 years, we've been training registered nurses at a high level to do anesthesia. We've trained over 150. They're in over half of the counties in Kenya, and now we're trying to work with the government to scale it up.
That's
to train,
very nice.
Train at a high level. Yeah.
I'm happy to have you, Doctor.
Yes,
Now,
thank you.
I want you to look at that camera and tell my viewer not to be discouraged, not to worry, not to fear.
Yeah.
When in theater, they're in safe hands, in the hands of the anesthetist.
Yeah, well, I thanks for watching, and I think that it's great to be a mother, and it just so happens you may have to have a cesarean section, and I'm here to tell you that it can be done safely. There's people that in this country that have been trained at a high level. It's very important to ask if they've been trained to do this and where they've been trained to do this. And again, there's doctors and there's clinical officers and there's registered nurses all over Kenya that have been trained at a high level. But your anesthesia provider is very, very important for you to survive the anesthetic and to have a healthy baby. But it can be done, and it's the more you learn about it, the better. So it's good to have you here today.
Wow, thank you very much. As you have heard from Professor McNewton,
Right.
yes, you are in safe hands, in the hands of anesthetist. I remain your show host, Ann B. This is Golden Mini Show, your show. Till we meet again, blessings. Bye.